Hello, I'd like to talk to you about the use of lasers for the management of sunspots in particular, but also for the management of superficial early skin cancers. And this is a guide for my patients. If you're listening to this, no doubt you have been recommended this treatment. Laser-assisted drug delivery involves the use of ablative lasers in particular to increase the uptake of drugs into the skin. There are many dermatologic indications for laser-assisted drug delivery, but in particular we use it in dermatology for actinic keratoses and skin cancer and scarring and scar prevention, particularly in our practice. The way it works is that the skin barrier is a very effective barrier to the delivery of drugs. So we drill these little tiny microscopic holes into the skin using a fine laser. This then allows the application of the drug to the skin surface, which slips down these columns of the laser that the laser has performed, and it allows deep penetration and more effective application of the medication for you. And we use a variety of drugs, but the purpose of this talk is to talk about how we use it for the management of sunspots. There are some side effects and there is an increased risk of higher drug reactions. However, sometimes that works in our favours, particularly with the in terms of the management of sunspots, which you'll soon see. Systemic absorption toxicity can be greater, but we do control for that, and you get more intensified localized cutaneous reactions when you treat sunspots. So as mentioned, this is a gentleman who has field sun damage. By field, we mean that the entire skin has loads of these crust lesions here, which are all precancerous sunspots. So sunspots do lead to skin cancer, and rather than treating the visible spots, you need to treat the whole area, as there's visible and non-visible sun damage. There are creams available to manage this, such as 5-fluorouracil and imecamod and other options, but those treatments require treatment for 3 to 4 weeks, and most people don't wish to walk around with a face that is very inflammatory for 3 to 4 weeks, and this treatment enables results within 1 to 2 weeks. There is evidence that laser-assisted drug delivery for sunspots results in higher clearance rate. It is associated with the necessity to enable less incubation time of the cream, and you do achieve a more homogeneous and deeper penetration of drug into the skin, and hence longer relapse-free times. But there is a chance of greater skin reactions and a pustular response, but that is expected, but does not influence the reason for us not performing the treatment. Sun damage on the lips or sunspots on the lips is called actinic cheilitis, and we can use this treatment for this purpose. There is a 92% complete response rate compared to 59% when you just do normal standard photodynamic therapy alone. We also use this treatment for skin cancers on the legs. It's been shown to be far more effective. Photodynamic therapy is a treatment that we dermatologists have used for years to manage field actinic keratoses. There's conventional forms, and then we have a type which is daylight photodynamic therapy, where we put on a cream, you simply go outside and it's activated by the sun. And there are some other simulated daylight treatments around the world. But what I'm talking about here is laser-assisted photodynamic therapy, which is great and has more long-term results. This is just to demonstrate what you will go through with the treatment. You come in, my nurse will perform a very light, gentle laser treatment on your skin. It doesn't feel particularly uncomfortable. You actually don't require any local anesthetic. Then we paint on the product onto your skin, or rub a cream onto your skin. It's like this. So we just paint it on, which can be a bit stingy when it's applied, but we try and blow some cold air onto your skin to reduce the discomfort. We need to let that cream or product incubate. The incubation times do vary, which may be from anywhere from 60 minutes up to 180 minutes. This is the reaction the day after the treatment, so it's reasonably intense. Some people can report feeling a little bit uncomfortable, but others just tolerate it very easily. But then look at the result 2 weeks down the track. The skin is clear and the results are sustained. This is another patient of mine, just to demonstrate to you the process. He's a gardener and a surfer, a lot of outdoor sun exposure. He came in, I performed the laser on him. As you can see, he's not complaining of any discomfort. We then occluded the nose and the area and treated the rest of his face, and that's him saying he's not feeling any discomfort. This is him immediately after the application of the treatment. We then need to activate the drug, and we can use various options to activate the drug, which include something called a red light, or we can use this laser. As you can see, he's not feeling entirely uncomfortable there, and this is his recovery. Day 1, he's looking a little bit red and sore, but he's happy. Day 4, very crusted. Day 7, the skin is shedding, but he's completely normal at 2 weeks post-treatment. And just to describe his experience for you.
Hi, my name is Mark. I've had a lifetime of sun exposure due to sports, surfing and working outdoors. I had very bad skin damage from all the exposure. I was recommended to do the PDT treatment, which I have to say has been absolutely fantastic. I had skin discoloration, sunspots, broken capillaries, etc. And after the treatment, my skin has come back really well, and I've got to say it's probably the smoothest and the best and the healthiest and even coloured in the last 20 years. So the team at Northern Sydney Dermatology, from the front desk through to the nurses and the doctors, are just absolutely fantastic and make you feel very, very comfortable. So I've got to say, for the small discomfort for a few hours, the result that you get in a couple of weeks is nothing but outstanding. Thank you.
So in general, that is the response that I do get from my patients. They feel that their results have been exceptionally effective. In the practice, we also use this technique for scarring and scar prevention, but that has been covered in another talk. I hope that your questions have been answered regarding this technique. Please do not hesitate to ask myself or the team any further questions, and we'd be delighted to help you. Hope to see you soon. Bye now.